Hello, my name is Amanda Victoria, and I'm giving a summary of our previous topic, which is for the thermal injury. So the situation of this accident was the patient was rescued from in his apartment from two firefighters and was brought outside away from the danger. The patient was seen unconscious and did not have any identification card on him, so there are no relatives or friends at the moment of the incident, so they were not able to verify his identity. So the gender was male, looking around his 50s, and the scene of accident was around 11 a.m. at the time of rescue. So fortunately, at the scene there was a healthcare worker, so he helped out with the partially for the scene. So he made sure that was safety of the surroundings by moving the patient to a safer place. He did wear gloves and mask. He checked for the responsiveness of the patient, although the patient was unconscious and he did not respond to either voice or any pain stimuli. So he contacted for the emergency contact and he called the paramedics on 103. He checked for the airway was present, so airway was without any obstruction. He checked for the breathings. Yes, there was normal movements of the chest as seen. And circulation, he checked for the pulse was present, carotid pulse is palpable, the strength was pretty weak, the pulse rate was around 110 per minute, but the BP is not checked due to the lack of instrument for measuring at the time. And his immediate action that were taken was the water is poured all over the wound till the temperature is lowered. So at the same time, the paramedics have arrived, and after the temperature of the hand was lowered, they immediately applied the dressing over the entire surface of the burn wound and covered with another layer of the bandage. At the same time, they also did a thorough inspection of the burn area before that, where they found that there was local edema at the right hand of the patient, and so they gave him a local infiltration of non-steroidal anti-inflammatory drugs, ibuprofen, on the right arm to reduce the pain, swelling, and inflammation of the burn area. And upon inspection, the patient is breathing with open airway. There was no need for any intubation of the trachea. Skin and mucous membranes, they are evaluated and they appeared dry. Patient still did not respond to any stimuli and remained unconscious. So they immediately gave him a normal saline, around 1 liter intravenously, given immediately on the opposite arm at the cubital access for over a rate of 10 minutes per liter. And immediately the patient is brought onto the ambulance on a stretcher and the vital signs are monitored. So patient is directly sent to hospital and is admitted into the burn unit of the emergency department. And also at the delivery of patient to the hospital, patient regains his partial consciousness and was able to respond to voice stimuli, but with uncomprehensible sounds. So next is for the subjective examinations. Unfortunately, due to the middle grave condition of the patient, the physician was unable to get a direct information for subjective examination from the patient himself, as he did not have any relatives accompanying him or any guardian. So however, we still continued with the other examination for the patient. So moving on with the general inspection. So the general inspection, we had grave, middle grave, and the consciousness of the patient was supple with the GCS scale of 11. Posture of the patient was relatively like passive posture, and for the skin, he appeared dry. He has a dry skin. The skin turgor decreased, although from the report of the paramedics, they have reported that was edema, but since there is a bandage over his right arm, they cannot check whether he really has an edema. And other systems like muscular systems, the patient could not move his right hand as the muscle strength on his right hand is pretty weak. There were no strength at all compared to his left hand, which is normal. And while checking, they checked for the head, eyes, nose, and lips. They checked that his nose was participating in the his nasal wings were participating in respiration, and they checked for his body temperature, which was 38.2 degree Celsius. And other than that, for the general inspection, there was nothing else, no deformations or nothing abnormality was found for the general inspection. So the conclusion from the doctor was the patient has a sign of non-hemorrhagic dehydration due to appearance of dry skin, dry lips, and decrease in skin turgors. And patient was conscious but only respond to verbal stimuli because the patient suspected to have a hypovolemic shock. And next, about the respiratory system. So during inspection, I would like to emphasize that the doctor physician has found that the nasal wings participated in the respiration. There was sign of singing of the nasal vibrissae. There was hoarseness in his voice, and there was also presence of carbonaceous sputum during cough. As for the palpation, although there were absence of pain, tenderness, and fractures or subcutaneous emphysema that was found, however, they did find a decrease in vocal fremitus, a decrease in elasticity of the chest. And for percussion overall, it was normal. Auscultation, the doctor found that there was sounds of wheezing in both lungs and decrease in breathing sounds. So the conclusion from the doctor was the respiratory system is compromised. So based on the patient presented like symptoms, maybe the patient has like inhalational injury causing from the thermal burns. So the doctor suggested that we have a close and frequent evaluation of the vital signs such as the respiratory rate and pulse oximetry and securing the airway. And also maybe we can give a high flow oxygen therapy is needed so that we can maintain the oxygen saturation for at least more than 90%. And also for laboratory examination, I would suggest that we give carbon dioxide, oxygen, lactate levels, and sputum examination is also recommended. Other than that, instrumental diagnosis, for example, screening tests like chest x-ray is also recommended. Maybe if to decrease the secretion of the sputum, mucolytics can be prescribed to decrease the secretion of sputums. And if mucolytics is also not effective, maybe a nasotracheal suctioning will be done. And also bronchodilators can be also prescribed if there will be bronchospasm detected in the patient. So, and also during the recovery of a patient, an incentive spirometry is recommended for training for the lung functioning of a patient. Yes. So as of that was the only part that we have discussed for the terminal injury for our topic. That is all. Thank you.